SPECT MPI, or single photon emission computed tomography myocardial perfusion imaging, is a widely used diagnostic tool in cardiology. However, like any medical procedure, it has certain contraindications that must be carefully considered. In this video, we'll discuss both the absolute and relative contraindications for SPECT MPI and why it's important to evaluate these before proceeding with the test. Patients with uncontrolled or severe bronchospasm, such as those experiencing an acute asthma exacerbation, should avoid pharmacologic stress testing with agents like adenosine or dipyridamole, as these can worsen bronchospasm. Performing a stress test soon after a myocardial infarction is risky and can exacerbate the condition. Patients with unstable angina, particularly when unresponsive to treatment, are at higher risk during stress testing, which could trigger a cardiac event. The stress induced by SPECT MPI, whether through exercise or pharmacologic means, can worsen an aortic dissection, making this condition an absolute contraindication. Severe uncontrolled hypertension poses a significant risk during stress testing, potentially leading to a hypertensive crisis. Stress testing in patients with severe aortic stenosis is generally contraindicated due to the risk of severe blood pressure drops or other complications. Patients in a state of decompensated or acute heart failure should not undergo stress testing as it may worsen their condition. While not an absolute contraindication, patients with left bundle branch block or pacemaker dependency may have abnormal perfusion results, complicating interpretation. In patients with severe obstructive hypertrophic cardiomyopathy, stress testing could provoke arrhythmias or exacerbate outflow tract obstruction. Stress testing shortly after a stroke or TIA can increase cardiovascular demands, posing a risk of another event. Stress testing in patients with known significant left main coronary artery stenosis can provoke ischemia, requiring careful monitoring or alternative tests. Patients with uncontrolled or high-risk arrhythmias face increased risks during stress testing, particularly with pharmacologic agents. SPECT MPI is generally avoided during pregnancy due to radiation concerns, with alternative non-radiating tests preferred. Stress testing soon after surgery or trauma may exacerbate the body's stress response, posing cardiovascular risks. Severe obesity can compromise image quality, leading to suboptimal results. While this isn't a strict contraindication, it affects test selection and interpretation. Patients unable to exercise might undergo pharmacologic stress testing. However, if they have contraindications to these agents, alternative approaches are needed. Pharmacologic agents like adenosine or regadenoson are contraindicated in patients with bronchospastic disease or significant hypotension. Dobutamine is contraindicated in patients with significant arrhythmias or severe aortic stenosis due to the risk of exacerbating these conditions. While SPECT MPI is a valuable diagnostic tool, it's crucial to consider these contraindications before proceeding with the test. Careful patient evaluation helps ensure safety and the best possible outcomes. Always consult with your healthcare provider to determine if SPECT MPI is appropriate for your condition. Thank you for watching.